We recently had an experience in our family that again reminded us of how much the HTC is our partner. Our son's experience as a young adult with the HTC has been very important in his life and in our life. A few months back, because of the way we now order factor, we have to wait until there's very little left in the refrigerator, just a few doses. And if you happen to have a bleed, that can go really quickly. Well, this happened to him.
It was really scary. I remember because I did the math and I figured out, well, $5 a factor. I don't quite have enough for 7 or 8 days. And so this made me realize that I need to reevaluate how I interact with my insurance company and my specialty therapeutics company.
It felt very personal because he was my own son. I always thought that I would never allow for coverage to lapse. I was one of those people, and I know I have many friends in our community who feel invincible. We have good insurance, that'll never happen to me. And that'll never happen to me turns into it just happened to me. Well, of course, I immediately called our insurance agent on a Friday afternoon at 6 o'clock. That took a lot of telephone calls. And he said that there was indeed a lapse in coverage, but that was a problem with paperwork, and that they would be able to get that fixed in less than a week. In less than a week was not an option for us. My son needed factor that day, the following day. He was having an active bleed. He had run out of factor, and because of the way the system works, we always have to wait a few days too long before we order that factor. So there's very little time for mistakes or for bleeds. And in this case, both happened. I felt so very fortunate to have that relationship, not as a personal relationship, but as part of the community where we know that because the HTC exists, there is a safety net. There is an organization that cares for all in our community, whether we are patients of the HTC or not.
My name is Val Bias. I'm the CEO of the National Hemophilia Foundation. I have severe hemophilia factor IX deficiency. I've been treated at a hemophilia treatment center since I was 5 or so. My first nurse was Penny Holmberg. She taught me to self-infuse around 11 or 12 years old. She let me practice on her arm. She was like my second mom. My next nurse, when I moved to San Francisco, was Susan Karp, and we were together for 29 years. I moved to Washington, D.C. I had a great nurse there at Georgetown. I live outside of New York now, so my treatment center is in Newark, New Jersey. So treatment centers have served me well throughout the years. They're the ones that are responsible for consistency of care. They have rehabbed me a number of times after I've destroyed myself. It's the reason that I can stand up and walk and talk.
A hemophilia treatment center is a center that specializes in treating patients and families who have bleeding and/or clotting disorders. The comprehensive care team at this particular center consists of multiple disciplines. So when a patient comes into their annual comprehensive care visit, the patient is able to see many professionals here.
So for example, we have a psychologist that helps address the mental health issues of our patients and their families. We have an educational specialist who helps our kids thrive in their schooling and helps our young adults apply for college and helps our adults who are having some learning issues possibly in their job.
Many of these resources have been made possible through the revenues that come in through a 340B pharmacy program. The 340B program was enacted by Congress in 1992. This allowed hemophilia treatment centers as a covered entity to access discounted pricing for our patients. Many centers across the country have had these 340B programs or pharmacy for many years in their centers. These pharmacies actually are a big component of the integrated care that treatment centers provide to patients and their families.
All the rules and regulations that are around the 340B programs, they're very tightly regulated programs. and one of the features of these programs is that all of the funds that are gained by the HTCs that have a 340B programs have to stay inside our hemophilia community.
We use our factor funds to support the salaries of our physicians, of our nurses, our social workers, and physical therapists. But not only that, we use our revenues to help support the more extended services that our patients and our families need. So we're using our 340B funds to train the future generations of care providers that are going to help the people in the bleeding and clotting disorders community. We have many other services that would not be available for our patients and their families without the support of our 340B program.
Last year I was rushed to the emergency room with severe abdominal pain. Without thinking twice, we went directly to the hospital which housed my HTC. It was 4 in the morning, so I knew the HTC staff wouldn't be present. Once I informed them that I was a hemophiliac, I was rushed into triage. I was examined within minutes. My hematologist was contacted. I was prepped for emergency appendectomy surgery, infused with factor, and brought into the operating room, all within a couple of hours. Having hemophilia can impact your quality of life. It can cause disabilities and can create healthcare issues throughout your life. I know that the comprehensive care I received from my HTC is the reason why I am where I am today.
I just recently climbed Mount Everest, which was just a crazy adventure. I did that just this last year. I think having the Hemophilia Treatment Center available to me made all of my goals and dreams possible, you know. So when I told them about my idea to climb the 7 summits, which are the highest mountain on each continent, they didn't freak out and like tell me no. They're like, okay, that's a new goal, and we're just gonna have to modify your treatment. I've been going to the Colorado Hemophilia Treatment Center my whole life. I don't remember a time that the treatment center wasn't a part of my life and the staff wasn't a part of my life. My nurse growing up, she started as my nurse when I was 2 years old, and was my nurse all the way through college until she retired recently. And she was like my second mom, you know. She was with me through everything, all the transitions in life. She taught me how to self-infuse. The treatment center kind of became more of like an extended family for me, especially growing up. My parents and my mom especially, you know, relied on the treatment center, you know, all the time. I've never known any different, and it's pretty cool to have that, you know, care throughout your lifetime with the same team. I actually got my permit, was denied to go there a few years ago because of my hemophilia, and once again, like, the HTC staff stepped up, and this time when I applied, they had a whole bunch of accompanying information that I submitted with my permit saying that, you know, they've talked with me, and we've developed a plan, I know how to treat myself. They're always there for you, and it's pretty special, like, to have that care. And I know a lot of, you know, places don't have that. A lot of other chronic disease states don't have that, so I feel like we're pretty fortunate in our hemophilia community.
This group of people, I could FaceTime them if I ever need anything. Hey, this is what's going on. Does this look okay? Do I need to come in? Do I need to be seen? No, you're fine. Go to bed. Give factor. Go to bed. You know, we'll see you tomorrow. So they tried to save me a trip to the ER that is very extensive, that I don't need to go because I could handle it myself and be seen the very next day. So these people, like I said, I couldn't do it without them, and that is the truth. I just wanted to give my heart, you know, to the Hemophilia Association and everybody involved with this.
I'm a pharmacist from New Orleans, Louisiana, and I work with our Hemophilia Treatment Center. I'm part of the interdisciplinary team. That means social workers, nurses, physical therapists, physicians, research team. We all work together to care for our patient. My role is to optimize medication therapy in our patients. I do this in many ways. I spend a lot of time educating our patients. I help the patients manage bleeds. I help to increase their adherence by monitoring their logs with them. I get their factor to them in time. I manage assays so they're most cost effective for our patients and our payers.
The Hemophilia Alliance is an organization that helps support hemophilia treatment centers. It's made up of a membership of treatment centers with 340B pharmacy programs and has been in existence for almost 20 years. The mission of the Hemophilia Alliance is to provide support to hemophilia treatment centers who have 340B programs so that they can provide the services needed to their patient population. Through the Alliance, we are able to support services for staff at the Hemophilia Treatment Center to try and really break down things that are going on that may impact their Hemophilia Treatment Center. The Hemophilia Alliance works closely with chapters across the country, and they work very closely with manufacturers as well. This allows the membership to know what is going on in times of shortages so that patients' needs can be addressed as quickly as possible. The Hemophilia Alliance has actually been very beneficial for hemophilia treatment centers. When I first started in hemophilia, many hemophilia treatment centers were struggling to develop their 340B programs. When hemophilia treatment centers were created, many hemophilia treatment center programs worked very individually. With the creation of the Hemophilia Alliance, hemophilia treatment centers were able to work closely as a network, as a membership, as a group, to be able to network with one another and provide services and advocacy. So the Hemophilia Alliance through the years has been able to bring Hemophilia Treatment Center 340B programs together as one voice to advocate for the needs of our patients instead of individual treatment centers being able to do that on their own. As a whole, we're much better in impacting our patients and caring for the community.